Broadcasting live from the Business RadioX studios in the Twin Cities, it's time for Minneapolis-St. Paul Business Radio. Now, here's your host.
And hello again, everyone. Welcome to another edition of Minneapolis-St. Paul Business Radio. I'm John Ray, and folks, I've been looking forward to this one. Daniel Larson is with us, and he is the founder, the CEO of Kairos. Daniel, welcome.
Welcome, John. Thank you for having me. Good morning.
Yeah, good morning. It's great to have you on the show. Tell us a little bit about Kyros. How are you serving folks out there?
Yeah, absolutely. So Kairos is a marketplace platform that is built to serve the providers in this substance use disorder and recovery industry. So we have a marketplace of providers that are out helping about 700 clients in the Twin Cities community that are suffering and diagnosed with substance use disorder. So we're a cloud-based technology that connects people that desperately need help with people that are available to help them and qualified to help them.
Wow. What fantastic work. Let's talk about your journey and the entrepreneurial journey you went on, and what led you to start Kyros?
Yeah, absolutely. So, born and raised in St. Paul, started kind of entrepreneuring at a young age, went to a business high school that ironically now is out of business, but always had an interest in building companies, building systems, bringing new ways to look at really archaic things. So, after several years in small businesses, retail and service businesses, got into startups about 9-10 years ago at a company called Field Nation, which was a marketplace to connect IT providers with deployments out in the field to support kind of IT technician work. Mm-hmm. So in my personal life, I've had, several relatives that have lost to substance use disorder, struggled with my own recovery in 2019, and decided I wanted to do something meaningful, impactful with all of this breadth of technology that I've been able to acquire over the years, and then also just ways of innovating in spaces. And so when I looked at the recovery industry, there was such an opportunity to help people that were dramatically underserved by technology and modern business practice. And it was something that I could do and wake up every day and feel like I actually made a change and an impact. So that was kind of the crux of starting Kyros, was just how do we, build something that is innovative and has a good purpose behind it, and that is so timely in kind of the midst of this opioid epidemic that we're facing.
Mm-hmm. Wow. What a great story. So talk about maybe what you learned from your own experience, and congratulations on what you've done in getting to this point in your life. That you must be proud of yourself, and those that have supported you must be proud of you. Talk about what you learned in that experience specifically that led to thinking about the opportunities in founding Kairos.
Yeah, absolutely. And so, when I engaged in my own recovery, it was kind of this thing where, the first thing that you do is you go to Google, right? And you see what's out there, like what type of services are out there, what's a good fit for me. What do you like? Because recovery is all about what you're willing to do, right? There's a million options out there, but if you're not willing to take any of them, you're probably not very far.
Right.
So, going online, there was 1-800 numbers that you could call that would give you lists, or you could call your local county and they would print out an Excel sheet that said, revised 2009, call through this list. If anybody's still available, they can help you. And I started just getting really anxious, how am I going to do this? How am I going to, tackle this major obstacle in my life? And ended up finding myself at Teen Challenge. I called, 2:00 in the morning saying, hey, you know what, I'm struggling with a drinking problem and I need some help. They had mentioned that, we're kind of full for getting an assessment. The way that the process starts in the state of Minnesota is a chemical health assessment. And they were like, we're full, but somebody always cancels, show up anyway. And so I got there 7:30 in the morning, signed myself in and waited. And I must have been there the only day that nobody canceled their appointment. So I sat in the lobby for 9 hours. But I was kind of just determined. And, a licensed alcohol and drug counselor actually stayed late to do this assessment and asked me a barrage of questions. And those questions were objective questions. They could have been filled out way beforehand. It didn't require a professional to do so. And I'm like, man, I could have filled all of this stuff out. You guys could have had this information before I got here. And then also there was just repetitive questions asking. Everybody asked, what's your first name, last name, date of birth, drug of choice, that kind of thing. And so as I'm starting thinking about this and how the information was transferred and looking at these people that were great people, really passionate about helping, but didn't have enough bandwidth to think about how they were doing things differently. Just looking over the shoulder, looking at a tool that looked like an old Access database, and just understanding that the technology community actually owes it to this group of people that are doing this fantastic work to build something better. And so, as I started thinking about it and going through the process for a couple of months and just understanding what information wasn't being retained and things like that. And then thinking about my little brother, who I actually lost to addiction last year. He went through, I don't know, I would say 12 or 13 different treatments. And that's including Hazleton. That's including, shipping to Florida to see if we his environment, all this other things. And none of these people were sharing information. And so you think about one of the oldest issues of like the community suffers, which is mental health and substance use disorder. You think about the dramatic impact it has not only on the economy, but the resources that we pour into it, and how visible it is to quality of life when you're walking around the city. And we're not even getting them the technology that companies were using 10 years ago or 5 years ago. And so giving kind of a holistic 360 view of the client is kind of where we started. How everybody that's involved in participating and throwing a lot of time into these people, how do they get on the same page so they can move faster and be more prescriptive with their advice, be more prescriptive and intentional with the things that they're recommending that these people do. And then doctors kind of using all that information to get the right prescription regimens or place them in the right group counseling session and matching them with providers. I mean, all of these things are kind of table stakes in normal technology marketplaces. And there's no concept of that at all in the industry. So there was an opportunity there. And honestly, if you think about the impact that the opioid epidemic has had on just the society and how just devastating it is, especially when you think about underserved populations, which is something that we focus on quite a bit, right? That they are just disproportionately impacted and their resources are nothing. And you look at rural communities and things like that, where we can't even get the people out there because there's not enough providers for the people that need help. And so what we do with our technology is we rapidly scale the workforce. We upskill workforces from other adjacent industries. So part of our model is taking people in recovery that have a year of sobriety that makes them qualified as a peer recovery specialist because they have a lived experience and they've done it successfully for a year, which dramatically improves their chances. We give them free training where the only scholarship based free training in the state of Minnesota. We train people for free that go to competing organizations and things like that, because we know we need to get the workforce out there. And so we take people that don't have a lot of skills, except for their life skills in recovery. We train them, we get them certified, and then we give them a livable wage job to go from somebody that is on, group residential housing or housing support, on SNAP benefits, on prepaid medical assistance programs or PMAPs in the state, or Medicaid assistance programs. And they're taking up all of these state and tax dollars. We train them, we get them qualified to go and help somebody that's on day one of recovery. And we give them a job where they make on average $20, $21 an hour. And so now they can do a lot of things that they couldn't do in the past. They're not a drain on the system. They're tax paying providers. And it's just a net benefit to everybody involved. The community is better because you have somebody that's engaged in recovery. The people that are just entering in recovery are getting support, and people are able to do some of the things that, kind of devastated their life in the first place.
Yeah. And I'd be remiss if I didn't offer condolences for your brother. I mean, for you to keep going and make it happen in your company through all that as well, is admirable. So we're sorry to hear about him. And I guess I want to kind of summarize a little bit, I think, of what I think I heard you say with your brother's experience, your experience, and others that you've seen. It sounds like what you're doing is removing friction in the system. I mean, in terms of being able to get signed up and get that recovery going, because you've got patients there that like are on the edge, right? I mean, and they may run into a roadblock, and it's like suddenly that may stop them from going forward, right? I mean, is that a fair way to put it?
Yeah, so 100%, and actually that's what Kairos means. It's a play on the ancient word of Kyros, which means the right opportune time. So you have chronos, which is chronological time, and Kairos, which is the right time. Mm-hmm. If you think about somebody that is on, let's use opioids as a fantastic example of needing to have the most frictionless experience. But if you decide to stop taking opioids after a fentanyl addiction or a heroin addiction or whatever, you're physically ill within 7 to 8 hours after doing that, sometimes as early as 6. So if you don't get an opioid replacement prescription, if you don't get in somebody with supervision, you become physically ill, and your body is telling you need more of that drug, right? And so if you think about the most animalistic survival mechanism of like, I just need to do this because my body's telling me I need it. And I'm running into long waits, or people asking me frustrating questions, or even wasting time and getting me where I need to go. And that's, if they have the time to help you that day. We talk to some organizations that they have people who are saying, I'm ready to go into treatment. And they're like, yeah, we will see you next Thursday. So just hang in there. Right. Mm-hmm. And so if there's not enough people to help, if there's not a system that can kind of traffic cop these things into the right place, people lose opportunities to get better. And that might be their last time, because the overdose rates are extremely high. The mental health piece of it makes it very difficult, and you're dealing with the most elusive population that our society encounters. And so it's really important to remove that friction and tackle those barriers.
Folks, we're chatting with Daniel Larson. Daniel is the founder and CEO of Kairos. So Daniel, let's talk about the services that you're providing. You mentioned matching up those in recovery with providers, specialists, what have you. Expand on the services that you offer.
Yeah, absolutely. So what Kairos is in essence, if you're looking at it from a business perspective, is kind of a business process outsourcing platform. So, John, say that you are a nurse practitioner that specializes in family medicine, and you're like, I have a 40-hour-a-week job where I'm seeing clients, but I have a passion to help people in the substance use disorder. I just don't want to make it my career, right? Mm-hmm. Kairos allows that provider to get trained to become a medically assisted treatment waived provider, and then we provide a platform where they can create a profile, get the liability insurance that they need, the malpractice insurance that they need. They have instantaneous contracted relationships with all of the providers to bill for their services. And then they have a host of clients that they can help that need their specialty. And so when you're thinking about trying to add more bandwidth to an overstressed system, we're taking all of the access bandwidth and providing that business process outsourcing for them to step into private practice, maybe just an hour, maybe just 5 hours, maybe just 10 hours a week. And so we can collect, a lot of good people that care about their community, but just don't have the wherewithal to see people that are hurting as bad every day of the week. And so when you think about how we do that with medically assisted treatment providers, we do that with licensed alcohol and drug counselors, and we do it with the peer recovery specialists that I mentioned earlier. It really is taking all of this excess energy from people that really want to help people that desperately need it, and we give them all of the the effort of turning on a light switch or signing up for a platform, right? I can go in, log 2 hours a week or 40 hours a week, depending on where you're at in your career, and you don't have to do anything. You don't have to think of the licensing process as an organization. You just have to have your own professional credentials. You don't have to go contract with insurance companies that generally take 6 to 9 months to engage. You don't have to pay for your own insurance, malpractice insurance, your general liability insurance. You have all of that through the platform. And the way that we produce revenue is we just take a percentage of that transaction from the insurance companies, and then we pay the rest to the provider.
Yeah, that makes a lot of sense. So how does the app work? I mean, does it start with the person that's in recovery or wants to be in recovery? Does it start with the provider? Where do you enter the picture, I guess is the question.
Yeah, absolutely. So the way that we work right now is we work as a technology enabled service that partners with organizations, right? Mm-hmm. So we grab large pools of providers and the space that need it. And then we partner with big either treatment organization, housing organizations, community organizations that have a service of a big population of people. And then we have them download the technology and find a provider that works for them based on a lot of different criteria, right? So if you think about some of the, let's just take, we support a place in North Minneapolis that services victims of human and sex trafficking, right? So these are women that were either human trafficked or worked as sex workers, had created an addiction through their experience there. And some of these women have children, right? And have served sexual abuse, trauma, and things like that. They can't just have any first available provider. Like I couldn't go in there as a 30-something-year-old male and go and provide help for this women, because I look a lot like the people that cause them the pain in the first place, right? And so we have to match the right person to the right population. The way we do that is we work with the organizations that understand, because if you think about the way that this industry works, it's a lot of niche providers that do that because they understand the particular circumstance of the population that they provide. And so we use that framework for these organizations to feed our algorithms on how to match the right provider. And we say, okay, it looks like this. It looks like, this person needs a female provider has some issues with or has some experience issues with child protective services or mental health or sexual assaults or things like that. And we say, this is the right person that's going to give you the best opportunity for success. You guys should work together, and you should help this person. So that's the way, in essence, that it works. The providers have full autonomy of the people that they want to work with. They only work with the people that they think they can really help, and the clients have full ultimate choice. And that is something that is really difficult to wrap your head around when you're in a position of going through recovery, right? You're so desperate, you'll help the first person that says yes. And that might not be your best opportunities for success. So what we do is we create a system that gives you an options of people, but we give you the first, the people that statistically are going to give you the best help.
Let's talk specifically about the types of organizations and specialists that you work with so that folks are clear on that, if we can, Daniel.
Yeah. So where we have found a lot of benefit is going into underserved populations and partnering with organizations that are already in those geographies, right? So we work with the East African Somali community quite immensely. And so when we went in there, we could go in there and say, hey, we're going to provide all of these services. We have a list of providers, and displace the people that are already doing good work in those communities. And that's disruptive, but that's not enabling, right? What we want to do is we want to bring the community together. So when we went to go work with these organizations, what they didn't realize is a lot of the work that they're doing, if they had the right contracting, if they had the right credentials, if they had the right business infrastructure, could actually get reimbursed for the work that they're doing, right? Instead of taking government grants, instead of taking private donations, instead of going through foundations, they can actually use a system, document the things that they do, and then bill against a fee-for-service policy with the state of Minnesota that these people are already using, right? So it's underused services that the state has said, this is what we need to support to solve the problem. And so that has impacts in dramatic ways, right? So we can reduce grant funding that goes into communities, or shift grant funding to things that are more appropriate, that aren't reimbursable by insurance.
Right.
The other thing is that it puts a 360 perspective on the care that the client is getting. And so now, not only do you know that this person's going through treatment through a licensed treatment center, and they're getting better, but they're also going through a psych med management or a psychiatrist to get on mental health medication that they're doing. And then, oh, by the way, they're also working with these community organizations that are specific to their cultural background and getting help. And so we do that with the East African Somali community. We do that with reentry populations or justice involved people. We work with the counties and their drug courts, federal probation reentry, victims of human trafficking, sex trafficking, victims of sexual assault and rape. And a lot of those populations, and then women with children, which is a very underserved population in the state because their situation is so complex and nuanced. It's really hard to navigate, and so we can create a framework to make that a lot easier.
Wow, what great work, folks, from Daniel Larson. Daniel's the CEO, the founder of Kairos. So let's be clear on how the app gets paid for, how the service gets paid for.
Yeah, absolutely. So again, we gather the qualified professionals, get their credentials, establish insurance contracts, and they provide billable service to people that have qualified insurance policies. And then we go and we bill insurance just like any treatment center would, any recovery community organization, any hospital, any clinic. The insurance reimburses those services. We take a service fee from that transaction, and then we pay the provider.
Wow. It's as simple as that, folks. It's simple. It's simple hearing it. It's not simple you putting it together, which makes all this work so well for all those involved. So this is great. But I would love it, Daniel, as we kind of come down to the end of our interview, if you could share a success story, maybe. I know you've had some early successes, and maybe if you could share one of those, that would be great.
Yeah, absolutely. So, one of my favorite success stories comes from one of our very first clients, and it's so it seems like not a big deal, right? But you have to understand, like when you're going through recovery, the amount of shame, the lack of dignity, a lot of the things that kind of take things away from you. Really starts taxing on the people. So, we had this gentleman, and he was one of our first clients, and he was just coming out of a year-long treatment program. And so he graduated, and he was going to sober living, and he wanted to find a job, or was required to find a job as a condition of his probation, but then also a condition of him graduating treatment. And so he worked at Chick-fil-A for like $12.50 an hour or something like that. So we assigned him with a peer recovery specialist and said, okay, what do you want? What do you need to do to be successful? And he's like, I haven't seen my wife, and I don't know how long. I can't see my kids. My job's not altogether that great, so I can't afford to pay my fines and things like that. I'd love to get my license back. And I would love to have a place of my own because I've never had my own apartment. And so we put together a recovery wellness plan, and we started knocking things out of the list. So we knew in order for him to get his license back, he had to find a birth certificate. His birth certificate is not as straightforward as you would think, because he didn't know who his father was or what state he was actually born in, because he was kind of displaced through the upbringing. And so we had to track down his birth certificate, found that, put him on a course to get his license back. He had a job at Chick-fil-A, but had never taken the public transit system. So we rode the bus to teach him how to take the public transit system. With that, he wanted to get a better job. And so we helped him search for jobs, put together a resume, had him apply at the Amazon warehouse in Shakopee. He got a job, went from $12.50 an hour to over $20 an hour, started saving up money. In that process, he came off of state-funded housing. He came off of state-funded insurance. He got his own private insurance. He saved up money to get his own apartment, and then also got a car. And then he came in and he got reunited with his wife and his daughter. And now they all live, his son, and now they all live in the same apartment together, and they've been reunited. So we're able to reunite this whole family by systematically working through things that a doctor or a chemical health counselor is not going to work through you, because they're the things that aren't medical or clinical in nature. These are life things that people just need to get hurdles from. And so by giving them that kind of multiple times a week touch point with real practical things that they can do, we were able to just remove what seemingly most people would look at and is like, how can you not ride the bus, or how do you not know how to look for your own job, or things like that. And they're people that never even thought that was possible. And so we were able to get him reunited with his family, and then off of about $75,000 in state-funded programming.
Wow. What a great story. Real quick, before we wrap it up, Daniel, is it, we're talking about the state of Minnesota, but is the app, can that be used in other states as well? If we've got folks listening that are in other states.
Yeah, absolutely. So state expansion is absolutely top of mind right now. So we're about to launch a pilot in Washington State. We're working on launching a pilot in Colorado as well, and then just having really preliminary talks in Ohio. But our goal is to be in 10 new states by June of 2023.
Terrific. Daniel Larson, what great work, folks. He's the founder and CEO of Kairos. Daniel, this has been quite a pleasure speaking with you. Congratulations on the great work you're doing. You're doing important work, and we're just honored to be able to celebrate it. But let's get to the most important question, which I know there are folks listening that would like to be in touch. So let's tell them how they can do that.
Yeah, absolutely. So if you'd like to be in touch, just reach out to us on our website is Kyros, KYROS.care, CARE, or info@Kyros.care. And we would love to help anybody that would need it, and happy to partner with anybody that is interested.
Terrific. Daniel Larson, folks, founder, CEO of Kairos. Daniel, thank you so much for taking the time to be with us.
Thank you, sir. I appreciate it.
Absolutely. Hey, folks, that does it for this edition of Minneapolis-St. Paul Business Radio. Be sure and join us next time. And if you'd like to hear past episodes, go to, there's a number of different URLs, but MinnesotaBusinessRadio.com is just one, or go to your favorite podcast app. For my guest, Daniel Larson, I'm John Ray. Join us next time here on Minneapolis-St. Paul Business Radio.